Learn how FP Development's automation is making an impact in hospital pharmacy at University Health in San Antonio.
I love automation. It's a passion of mine. And I know that we're early in the industry in terms of healthcare pharmacy being automated. And so I love partnering with a company, FP Developments, that is going to allow me to be innovative and creative and bring my ideas to life. I had recently attended a conference looking for a unique piece of automation, and I met FP Developments for the first time at the conference. They were a very inquisitive and insightful automation company and very willing to partner and create something adaptable and unique to my specific needs. I'd gone to this conference looking for a product line that would prepare oral syringes, knowing that we prepare about 700 to 1,000 oral syringes every single day, and it's all prepared manually. I needed to change that. That's not the right way to move forward. And so when I met FP Developments, they were more than willing to partner and look creatively at a solution for all of my oral syringe packaging needs. And out of that, the GenBot was born. The goals that we were looking to achieve with the GenBot were first and foremost safety, which we have in spades. Second is reproducibility, high efficiency. And third was resource reallocation, meaning my technician staff can perform other functions while the GenBot is performing her function. We are moving forward with a central fill solution. We are expanding our hospital. We won't just be a flagship, but we'll have other community hospitals and clinics to fill medications for. The GenBot will move to a central location, and the GenBot will be able to accommodate not just the workflow we have here at the flagship, but then the workflow that we have at all of our community hospitals and clinics. So we're gaining a lot of efficiencies by actually moving this robot to a centralized distribution model. The GenBot isn't just for today, it's for the future. And so I'm really excited to bring GenBot to central fill to allow us to prepare more doses for the entire Bexar County, which is our mission. I also am very excited about the partnership with FP Developments because I know that there are tons of ideas that I have that I would like to bring to life, not just in the oral syringe packaging space, but all other spaces of the pharmacy. My goal is to create a high reliability, 100% automated pharmacy, and I believe that the partnership with FP Developments can help make that happen. My goal for the GenBot is to bring the GenBot nationwide. It's such a hidden gem. Everybody needs access to this. This is the right thing to do for patients. Safety needs to be priority and automation makes it happen. GenBot not only gives you safety, but it gives you that efficiency, high reliability. That's what every pharmacist wants. That's what every patient deserves and needs. And my goal is to bring it out there for everyone to access. You know, my mom is a nurse and my sister's a nurse, and so we talk about, they're just a daily, what's the lifestyle like for a nurse and taking care of patients. And it just makes their life so much easier when we can have products at the bedside ready for the nurse at any point in time. So we have over 100 oral bulk bottles on formulary, and we have really worked to negotiate repackaging of the majority of them. And the reason we did that is because we want to make sure that the product is at the bedside, readily accessible for our nurses and for our patient. We do everything. We live and die by safety here. It's the number one thought in our mind. And so automation allows us to do repetitive tasks over and over, and it builds in those safety features that sometimes aren't always occurring in regular process lines. So adding automation for high volumes, high reliability, high reproducibility is part of what we do. So the GenBot brings safety to the department when we prepare oral syringes. It does that in a couple of ways. There are two different pieces within the robot. You have an air inline detector and a syringe pullback re-examination. And those things are instrumental and important because after throwing up 1,000 syringes, people get tired and things often get missed, but the robot never gets tired. So we know we have that added layer of safety that we didn't have previously. What I love about the GenBot, this piece of automation, is that it allows us to load up all the disposables, and then our staff can actually walk away from the product line to perform other tasks. So we're getting efficiencies built in with this piece of automation that didn't exist before. And that's really important, especially when volumes grow. Disease states happen too. We recently went through a COVID pandemic and we swelled in terms of our patient census. And so having automation that can accommodate large volumes of work, very adaptable at that, it has really helped us ensure that we are able to meet our patients' needs, which is really the mission of University Hospital. In terms of efficiency, what I love about the GenBot, and it exceeds every other piece of equipment that we have, is the speed at which it produces a final product. From start to finish, you can have a completed syringe within 30 seconds. It far exceeds the human counterpart. In terms of resource allocation, I'm able to have my employees perform other functions once the GenBot is all loaded up and ready to go during the shift. During the height of the pandemic, we had a swell in patient census, which meant a large volume of oral syringes that needed to be packaged. The robot was ready to go. The great thing about the robot didn't catch COVID. So we were able to keep pushing through on that volume when sometimes our staff had to quarantine. We didn't know what was happening, and that was just part of what we had to do here. So having the robot available as a second pair of hands was instrumental in us making it through the pandemic. Yes, so University Hospital, when we were first looking at the GenBot, was going to be opening up a women's and children's pediatric hospital. So we were going to be absorbing an extra 300 beds dedicated towards pediatric patients. And we know that pediatric patient doses are typically very structured around that patient weight. So everything has to be individualized in a way that it doesn't in an adult population. So forecasting forward, we knew that we were going to have an increase in volume and oral syringe preparation need. So we partnered with FP Developments to create the GenBot in anticipation of this increased volume that's actually here with us today. And we're excited to be able to service that community.